So, so you definitely want to be familiar with those. You want to know them like you know the back of your hand. Um, but you know, not only do we have to know about the disease process, um, you know, if you guys are in nursing school, you know what it's about. But for the people that are not or anxious to be, um, when you get deeper into your nursing program, it gets harder and it gets harder and it gets harder. And you know, the class that I'm in right now is part one of med surge. The very last class is acute med surge. So we're dealing with more acute issues like a heart attack, a stroke, or something like that. Um, but anyway, right now, you know, learning about chronic diseases, you have to learn about the pathophysiology. You've got to learn about nursing implications. What are you going to do as a nurse for the patient that presents with hypertension, that presents with coronary artery disease, that comes in with diabetes and a sugar of, you know, 550? You know, it's like you have to know about that stuff. That's why you're in school to be a nurse. But also, you know, their big thing is nurses do a lot of teaching to our patients. For one, we're not doctors as much as doctors wish that we were, or they act like we are. But we're not. So we do a lot of teaching and we do a lot of interventions and stuff. Anyway, so they also want you to know, you know, what things would you teach for your patient about this disease? If the patient was being sent home, what kind of education would you give the patient being sent home with the type of medications that they've been prescribed? So not only do you have to know about the disease and the process and nursing implications, you also have to know about pretty much all the medications um, that have to do with the disease. So, and it's not all of them. Don't get me wrong, it's not all of them, but it's more of the more popular ones that you'll see in a hospital, clinical, or whatever setting that you're in. It's like mainly, you know, the most common ones or whatever. And so, and it's a lot of them. So anyway, it doesn't get easier. It only gets harder. I can honestly say though, the second time around, I feel ready. I feel like I know what I'm doing. And of course, you would say, well, you've taken this class before. True. But like I said, the tests are different. So when I took that first test, I can't lie. I studied. I did study. But I didn't study super hard. Like it was my first time taking the class. Because I'm like, I've taken this before. I got a feel for what she gonna be, you know, what the teacher will be looking for. Um, but when I took the test, and I took the first test, it felt like the first time. So now I've been busting my ass. This next test is on cancer, all the chemotherapy drugs. It's on radiation, of course, radiation therapy. Um, it's on HIV, TB, um, HIV, TB. It's on immunity. It's on rheumatoid arthritis, and it's on lupus. And I think I haven't left anything out, but possibly. But anyway, so that's where I'm at right now, guys. I'm retaking a class that I took back in August. And, you know, even though it was back in August, you might say, well, you had time to put another video up. You know, I still was trying to get over the fact that I failed a course, especially after I was doing so good. And I kind of let you know, me passing, I guess my cockiness, big headedness, set me back. It's been a learning experience. I can definitely say that. You learn from every single experience. Um, so that's, you know, that's how I'm taking it. That's my way of doing things. But already, I've only been in class for what, 3 or 4 weeks? Yeah, 4 weeks now. And I passed my first test. My second one is on Monday. So this weekend I'll be studying. Well, I've already started, but just saying throughout the weekend I'll be studying. And it's only the fourth week of clinical, and your girl has already gotten 2 satisfactory care plans. Like, where they do that at? You know? So I'm definitely proud of myself, but I'm not going to let not my pride, but just my accomplishments get in the way of continuing to accomplish and do very well. So, um, I mean, I struggled doing care plans at first. And if any of y'all need help doing care plans, send me a message. Um, I do my best to post a video or even to just write you back and share with you my way of doing a care plan and what makes it easier for me. Like right now, this was not me a couple months ago. It took me forever to get 2 set care plans. Just the thought of care plans, I dreaded. It would take me a whole day, maybe even 2. I would put it off, try to finish the rest tomorrow. It was just too much. Now, if I sit down and I just focus entirely on doing what I have to do, and say I'm doing a care plan, excuse me, I can get it done in like 2 hours, maybe even a little less, but 2 hours at the most. Um, so yeah, I mean, you live and you learn. If I was in my last class right now, which is the hardest class in the program, and I was still struggling with doing care plans, there's no way I would survive. So in a sense, I mean, I'm not mad about retaking this class anymore because I feel like I kind of got the hang of it now. I mean, I feel like, not just as far as with taking the test, but I have the hang of it with as far as the clinical setting too. So I don't know. I'm pumped up. I'm ready to go. I'm ready to get this over with. I'm ready to graduate. I'm ready to be a nurse. I'm tired of being a tech. Right now, I'm a tech. And I would encourage anybody in nursing school to be a tech first. One thing you don't want to do is be a green nurse. You do not want to hit the floor running as a registered nurse. I just passed my NCLEX. I'm an RN now, but I've never worked in a hospital before. So I'm not even really familiar with this setting and working here. You don't want to start off like that. Some people do, but I wouldn't encourage it. That's why I got a job as a tech while I was in nursing school, so that I could be familiarized with the hospital setting. Um, and also, it helps. A lot of things that are on my test, a lot of things that my teacher talks about, I can relate to work. Now, when I take my test, some things that I've learned at work, I can relate to my test. So it does help being a tech first. Um, I think it kind of gives you one up a little bit. You get more comfortable in the hospital setting as far as like talking to patients, touching patients. If you have issues with touching patients, then you don't need to be a nurse, okay? Because that's what we do. We get all up in there, all up in the crevices, all up in the stuff nobody else wants to deal with. That's what we do. And don't think just because you are going to be an RN, um, you don't have to clean poop or all the gory stuff. You have to clean shit, okay? You do. Just to be honest. I mean, don't think that that's what CNAs are for. That's what techs are for. No, my dear, that's your patient, so that's your shit that you need to clean. Yes, fortunately, if you have a tech or a CNA or whatever on the unit that can help you with that, great. Some techs, like myself, I mean, I'll take the initiative and go ahead and clean the patient up myself. If the patient can roll or whatever, and I go ahead and do it. But if you have a patient that, has no kind of mobility at all, they can't log roll, they're on a ventilator, you will have to get some assistance. But anyway, write me with y'all's comments. I love you guys. If you're in nursing school or you're trying, I wish you luck. I wish you the best. Just keep praying and having faith that you'll get through this, because you will. So y'all write me up. And I'm sorry, did I say write me up? Sorry, hit me up and write me a comment or a message or whatever. Mwah.